In this section, we will be analyzing prescriptions and medication labels. When we are finished, you will be able to look at a prescription, read it, know what the order is, know if you need additional information, and be able to compare it with the medication label and confirm the label is correct. There are a few other things I want you to know. Who is permitted to write a prescription for medications? What do pharmacists do? What is the difference between a generic and brand name medication? How can you tell if it is the correct generic for a brand that a doctor ordered? What are the rules when a client is discharged from an emergency room, urgent care, or inpatient facility with medication orders? Who can make changes to a prescription label? What are the rules for prescription medications kept in a facility? And what information needs to be on a PRN doctor's order or prescription? Be sure you are filling out your worksheet as you go, and you will be able to use it to help remember this information and study. You probably already know a lot of this information from Module 1, but write it down again anyway. The following licensed professionals are permitted to write prescriptions for the preparation and use of medication: medical physician or psychiatrist, MD; osteopathic physician, DO; advanced practice registered nurse, APRN; physician's assistant, PA; dentist, DDS or DMD; an optometrist, OD; and a podiatrist, DPM. A pharmacist is also a licensed professional. Most work in the community at retail drugstore or in a healthcare facility such as a hospital. Their duties include dispensing and packaging medications, supervising and directing pharmacy assistants if applicable, counseling and teaching patients on the use of their medication, and giving advice to other healthcare professionals on the safe and effective use of medicines. I could write a book on all of the reasons a medication order may change. Needless to say, if you are administering or supervising medications, at some time you'll have to deal with a medication order change. In Module 1, we discussed that a new order overrides the current order, and times when an order is automatically discontinued without a discontinue order. Remember, a change in a current order is one of those situations where you would discontinue the old order. Be careful, there may be times that a new order may be in addition to the current order for a certain period of time. So always ask if you're not sure. We need to be absolutely sure we are giving the correct dosage of medicine. You may not make changes to the label, like scratching out something and writing in the change. Only the pharmacist may change the medication label. Sometimes your pharmacist will be willing to either repackage or relabel the remaining supply to match the new order. If he is not willing to do that, and the insurance company will not approve more of the medication until the current supply is gone, contact the doctor or pharmacist to help you make the new dosage and give you instructions. Then put a sticker on the container that indicates there has been a change in the order. Write the new instructions from the doctor or pharmacist on a blank label, then put the label on the bottle in a way that does not cover the medication information on the old label. Usually you'll have enough room for the temporary label on the back of the bottle or beside the old label on the bubble cards. Be sure you discontinue the old order from the MAR and add the new order to the MAR. I will show you how to do that when we study the MAR later on in this module. Be sure you contact the doctor immediately if you are unable to make the dose or fill a new prescription for any reason. I'm going to review the situations where an order is automatically discontinued. First, a new order or change in a current order always overrides the order you have on the MAR. Second, a time-limited order is for a specific number of doses or days. Antibiotics are generally ordered this way. An example is Augmentin 750 milligrams by mouth twice daily for 14 days. Be sure you discontinue the old or the current order on the MAR by writing the word discontinue, the date, initial, then highlight in yellow the entire MAR entry across the row. Find the next available line and transcribe the new order on the MAR. Place a line through all of the boxes for doses you will not be giving. For instance, if you start the medication on the 5th of the month, line through the boxes for the 1st, 2nd, 3rd, and 4th. Again, you do not need a specific DC order, but you must be sure you have discontinued the medication on the MAR. Failure to update the MAR can lead to medication errors. Generic medications are often substituted for brand name medicine unless the doctor indicates on the prescription that there may not be a substitution. A generic drug must have the same active ingredient in the same amount as the brand name drug. However, the inactive ingredients may be different. Generic medications are generally less expensive. Some health insurance plans require that generic medicine be dispensed unless there is a medical reason the brand name drug must be given. Sometimes the doctor will need to have this pre-authorized, or the insurance company will not pay for the prescription. Below are some examples of common brand name drugs and their generic counterpart: Tylenol, acetaminophen; Colace, docusate sodium; Lamictal, Lamotagine; Catapress, Clonidine; Prozac, fluvoxetine. If the doctor's order or the prescription has the brand name on it and the label has a generic name, look carefully on the label and you will see generic name for the brand name. For example, Clonidine for Catapress. If you can't find it, call the pharmacy and confirm that the generic you received is for the brand that was written on the prescription. Be sure to document in your notes that you verified the name. Whenever a client is discharged with medication orders from the emergency room, urgent care, or any hospital or other inpatient facility, you must reconcile the medication with the primary care provider within 24 hours. So, what does this mean? You must contact the primary healthcare provider and let them know about the new orders or changes to medication. He or she should decide if they want new orders to stand, the old orders to be followed, or if they're going to change the orders entirely. Their instructions must be in writing and may be sent by fax or electronically supplied. A nurse may take the instructions over the phone, so they are active right away, but you will still need a written copy with the primary care provider's signature. It is very important that you document the response you get from the primary care provider to your request. Also, be sure to document if there is no response and all further attempts you make to contact the primary care provider until you do get a response. If your client is discharged from an inpatient facility and does not have new orders, be sure the discharging practitioner wrote an order to resume home medications. If you do not have this discharge order, you must contact the primary doctor immediately to get the medication orders, since you will not have any current medication orders.
What you are seeing is a generic prescription. We're going to dissect it and look at the parts so you will be familiar with the information that should be included. When we are through with this section, you should also be able to tell if you need a clarification of the orders for your MAR book. Remember, you must have a prescription or doctor's order for all medications, including over-the-counter medicine and dietary supplements, if you will be administering or supervising the self-administration. The first prescription will be for a routine or scheduled medication. There is standard information found on the prescription. The doctor or the clinic's information. In this example, it's Hometown Clinic, and the doctor's name is John Doe, MD. The patient's name and date of birth. The date the prescription was written. The name of the medication and the strength. The doctor may write generic or brand name of the medication. The pharmacist will generally dispense the generic version unless the doctor indicates not to substitute, but dispense as written. Instructions for use: how much, by what route, and how often to take. How many to dispense. The number of pills or the amount of liquid is written. It is best practice also to write out the number as a word, so the prescription can't be altered by just adding a 0. Dispense number 30 could become 300. How many refills? It is always a good idea to look at the number of refills that are left when you pick up a prescription, if the medication is something the person will be taking long term. There are times that the doctor will want to see the patient before he will authorize additional refills. Trying to make an appointment Friday afternoon because you will be running out of pills on Monday can cause a medication error because you ran out of pills. If there are no refills, just give the doctor's office a call to find out if it is necessary for the patient to be seen before additional refills can be authorized. The doctor's signature.
An MAP may not assist with PRN medication, including over-the-counter medication, without a doctor's order or a prescription. The order must contain the following information: the name of the medication, the strength of the medication, the route of administration, how often the medication is to be given, the reason to give the medication, conditions when you should notify the doctor, and the maximum number of days or doses. The second type of prescription we will be looking at is one for a PRN medication. Again, a PRN prescription contains the basic information found on the routine with some additional instructions: the doctor or the clinic's information, the patient's name and date of birth, the date the prescription was written, the name of the medication and strength. The doctor may write the generic or brand name of the medication. The pharmacist will generally dispense the generic version unless the doctor indicates not to substitute but dispense as written. Instructions for use: how much, by what route, and how often to take. How many to dispense. The number of pills or the amount of liquid is written. Again, it is best practice to also write the number out as a word so the prescription can't be alterated by just adding a 0. The SIG line is one of the differences in the example for routine and PRN prescriptions. SIG means write this. These are instructions to be included in the prescription. This part is very important and must be included for our purposes. For a PRN medication, you not only need to know what for, but the total number of doses permissible in a 24-hour period and conditions when you should call the doctor. Remember, the what for or reason to give the medication must be specific and must not require medical judgment to decide if it is needed. For example, if your client is nonverbal and has an order that calls for a medication to be given for anxiety, you cannot give it because you're not qualified to assess for anxiety. If the order is written to give the medication for anxiety, as evidenced by pacing or continuous vocalization, then you can give the medication because you can observe and document what you see and hear. How many refills, and then the doctor's signature. The doctor's orders, or the prescription, are another one of the tools you will be using to be sure medications are administered safely. By using them to double check when there is a difference between what is written on the MAR and what is written on the label will help prevent medication errors. Things change. People make mistakes when transcribing information from one MAR to the next. MARs aren't always updated as quickly as they should be. The key is always to match what is on the MAR to what is on the medication label. If it doesn't match, the first place to go is the prescription or the doctor's order. If it doesn't match, call the supervisor and report the discrepancy. There may have been a doctor's appointment with a change in medications, or they may have been dispensing error at the pharmacy. Have the designated person call the pharmacy to check on the current prescription. If it is not the same, have the pharmacist send a copy of the current prescription. The bottom line is don't give the medication until you track down why there is a difference. Remember, you only have an hour before and an hour after the medication is scheduled to administer without a medication error. No medication error is ever good, but it is better to give the medication late than to give the wrong medication or the wrong dosage. It is a good practice whenever a new MAR comes out or new medications are picked up or delivered, to match your medication labels to the MAR well before the medications are due. That way, if there is an issue, you will have more time to resolve the situation.